When they transferred her, Giovanna was essentially unresponsive. The gunshot wound to her head was severe. They really didn't think there was much chance of neurologic recovery. She was on a breathing machine. She was on powerful IV medications to control her pulse and her blood pressure, and on being fed by a tube. The family asked to come back to Phoenix to be closer to home and more support to see what could be done neurologically, though the prognosis given in Las Vegas was very grim.
I was there with Giovanna in her room, and I fell asleep next to her. I dreamt her that she came to me when I was laying there, and she kissed me on the cheek, and she said everything's gonna be okay. And I called her mom, and I told her mom what happened, and she said, okay, let's keep her alive going forward, because we knew she was there, and that dream just kind of sealed it, like, okay, we're keeping her alive.
When dealing with these complex medical and neurologic patients, you need a strong care team that's got lots of members that work as a team. When you have patients like this come here to Select, we have a lung doctor that deals with the ventilator weaning. We have a neurology on staff that helps with the neurologic prognosis. We have physical therapy, occupational therapy, speech therapy that work with her to try and strengthen her in all those different ways to help with recovery. You have all these team members that work together, communicate on a regular basis to really build a plan that's individualized for that patient and how to get them to where their next step's going to be.
It's amazing to see the communication that's required between every single team member, in that if one piece doesn't function, these patients don't get those results.
Our common goal is just to make sure that our patients stay safe and we can progress them to the best that they can be while they're here at Select.
It was almost like one day she was in a coma, it seemed like. And then the next day, it was just like she woke up, like a light switch just went off. And Select always talked about that.
Slowly, Giovanna began to get better. First thing we noticed was she began to breathe on her own. Next, she became more alert. One day, she started opening her eyes to voice, to touch.
I remember it clearly. Hi, Dad. My dad looked at my mom and yes, yeah.
Because that was the first time we heard her voice.
Yeah.
Well, they heard her voice in months.
She began able to get up and work with the therapist walking. Short steps, brief standing, but huge advances. And based on these continued successes, Giovanna was able to eat her first meal at Select right before she was transitioned to rehab. She had just a neurologic, miraculous recovery here.
I'm learning how to write on my left side because I was a righty before, and it's coming along. Yeah, I'm learning to do everything left side.
So to see them, not breathing on their own, not speaking, to some of them walk out of here without anything attached to them, just being a part of that process and having a patient or a family member just say thank you. It's a lot of motivation to keep doing what we do.
All the nurses, the respiratory therapists, the PT people there, the speech, they're very comforting because they really cared. They were there to check on the well-being, not just of Giovanna, but our family.
The reason I like working at Select is because the patients are so critically ill. To get them to turn the corner and to maximize someone who you might not think would make it, that they're doing well, huge difference, and Select does that.